Welcome, everybody. My name is Leticia Cortez. I'm a nursing professional development specialist here at Stanford in the nurse residency program. And this is our interview preparation webinar. So we have some quick objectives that we'll go over for you, the viewer of this webinar. By the end of this webinar, you, the participant, will be able to understand our residency program interview structure. You'll understand key features of behavioral interviewing. You'll be able to articulate successful strategies to prepare for behavioral interviewing. You'll understand the goals and structure of the curriculum and nurse residency program. And you'll be able to participate in dialogue with key members of the nurse residency program, including myself, a member of our human resources team, and current residents in the program. So we're going to go over the nurse residency program interview structure, but before that, we're going to go over the panel interview schedule. So here is a list of the schedule of the upcoming cohort. You'll notice it's divided by specialty areas. So we have our critical care areas, we have medicine, surgical, oncology, a float pool, clinical trials, psychiatry, and adult emergency medicine. We have the dates here listed. Right now, HR is currently working on reaching out to candidates to schedule these interviews. If you may have already received an invitation, or we are still working on that currently at this time. Each panel is going to be facilitated by a member of our department here at the Center for Education. The number of panel members or candidates in each panel is determined by the amount of people that are projected to be hired in that area. So if you look at critical care, we have 40 people that will be placed on the panel with an intent to hire a projection of about 15 candidates. We have our medicine, surgical, and oncology divisions are divided into two because they're larger departments of the hospital. We're bringing in 80 candidates with an intent to hire 30. So it's 40 on each panel with an intent to hire 15. And so those are our larger departments. So if you're interviewing for one of those, the interviews are separated into two sections because it's just a larger volume of people we're bringing in. You'll see that we have float pool, clinical trials, inpatient psychiatry, and our adult emergency medicine, bringing in 20 people with a projected number to hire of 2. So we'll have these interview dates. Once the interview panels are concluded, a unit level interview will be scheduled, and those are to be completed by July 1st with final offers to HR by July 8th. And we'll go over a little bit more detail on that. So we have interview levels of what I talked about. And so what we were just talking about and showed you that graph there was we're talking about panel interviews. So panel interviews are in a virtual setting, in a virtual format. It's based on per specialty. So if your specialty level of preference was the medicine department was your first choice, second choice was surgical, third choice oncology, we try to place you in the areas that you preferred based on how you scored in the process. So it'll be a panel. So just for example, if it was medicine was your first choice, we placed the medicine panel. You would attend that panel and you would have all the hiring managers in that medicine specialty area present in the interview. You'd be joined by 3 other candidates. There'd be a total of 4 candidates in each panel. And we would be conducting the interview using behavioral style questions. And at that time, there's no room for questions for the candidate to ask. So if you could see that schedule was jam-packed, it's over an 8-hour day with panels every hour with a break in between for lunch. So if you can think there's 4 people being interviewed, getting asked a series of questions, it goes pretty fast. So at that point, we don't allow for a question and answer session. But at the conclusion of that interview, the managers will get together of that panel, the managers will get together and decide on what candidates they want to bring in for a panel, for a unit level, department level interview. The unit level, the department level is the same format per se, it's virtual. But the unit hiring manager will be there with their team. So they might be joined by their educator, by a clinical nurse specialist, maybe some clinical staff that are on the unit, nurses or nursing assistants on the unit. There'll be one candidate on the interview, so it's a more intimate level where they can ask behavioral style questions, but also candidate specific questions. So if you think about, they might say, what are your strengths, or what are your areas that you can improve upon? And that would be the opportunity where you would then have the chance to share any more relevant information you'd like, or ask questions about the unit or the position, anything that you would find of interest to the unit that you're applying for. Okay. So we'll just compare quickly here. We have panel interviews. The dates are starting on the 20th, and they go out to the 24th for the panel interviews. Then you move to the level of the unit level interview, where you will be brought in and it'll be one candidate on the panel compared to 4. Behavioral style interviews questions as well, but also candidate specific questions. These unit level interviews can start as soon as the panel that you're interviewing for closes. So if you're on the first 2 days of a medicine panel and they conclude interviews at the panel level on the 21st of June, as soon as the end of the day or the next day, you can be called to set up a unit level interview, department level interview. But all the way until the 24th, when all the panels have concluded, is when the managers usually start getting the unit level interviews set up for the next week. With that being said, final offers need to be out to HR by the 8th of July. So all the department unit level interviews should be completed by the 1st of July. Okay. So how to get to that point: once you receive a invite, you'll receive an email, you'll get scheduled, you'll receive an email with a Zoom link to attend the interview. That will be provided, and you'll be able to join a waiting room similar to a Zoom meeting like this, but it'll be a waiting room. So you'll be placed in the waiting room. We recommend you wait no sooner than 5 minutes before your interview time. We'll be conducting interviews in a sequential order. So every hour we'll be starting a new panel of interviews. So just 5 minutes before is enough time to log in. We'll let you in. When we allow you into the interview room, there'll be a set of instructions and introductions being made. And then we'll provide each candidate with instructions and give them an opportunity to introduce themselves. Once you choose to introduce yourself, you could choose anything you want to share. Some people just kind of give a really high level overview of their resume. They share, what school they went to, where their capstone was, any significant clinical rotations or volunteer work, military experience that they may have. And then following that, everybody does their introductions. We begin the behavioral interview questions. There'll be 4 questions for everybody to answer. Everybody receives the same 4 questions. We rotate the questions being asked in a way that each candidate, so you have candidate 1, 2, 3, and 4, will be asked one question for the first time. So if we have Desiree, you'll be asked question number 1, and then we'll rotate it throughout the candidates. And then we'll start with the second question to another candidate, so they hear it for the first time. So you have a little bit of time to hear what the question is and maybe think of something you'd like to share for that scenario. But every person will have an opportunity to hear the question for the first time and respond for the first time to one question. After everybody answers the question, we'll conclude the interview and we'll provide next steps and instructions. And like we said, the interview schedule and the sessions are jam-packed. It's 1 hour in length, which is really a quick amount of time to get 4 people, great candidates, to share their stories and answer all the questions. So we have people reaching out, or we get a lot of questions of once they have been scheduled or selected to have an interview, they want to know, like, okay, well, I have an interview. What should I do? How do I prepare? What are some things that I can do to make me stand out? So here we'd like to share some strategies for behavioral style interviewing. First, we answer, what is behavioral interviewing? It's not something that people are necessarily used to if you've never experienced this before. So what behavioral interviewing helps us do, or what we focus on when we're using this style, is we focus on the candidate's past experiences. We want them to provide, we ask for providing examples of things that they've done. So specific behaviors, knowledge, or skills, or even highlight the abilities that they've demonstrated. We use these questions to provide us with concrete evidence of how you've dealt with situations in the past, because by hearing how you've dealt with a situation in the past, it's a good predictor of how you'll respond given a similar situation in the future. Sometimes you may be prompted with a question or a scenario that you've never dealt with before, you haven't had that experience. I wouldn't recommend to say, well, I haven't had that experience as your answer. Take a minute, think about it, and try to respond the best you can, given the information, and relate something that you have experienced similarly. But I think with the situations we cover and the scenarios we cover in this webinar, it might help you navigate around that situation. So this style of interviewing also allows us to assess critical areas of the job, but also critical areas that are like fit the broader culture of the position. So it's not necessarily focusing on clinical scenarios of how you would respond to a patient who was having chest pain or was positive for having a myocardial infarction. We're focusing more on traits of a clinical nurse and how you utilize them and how you demonstrate those skills and behaviors and how you really use all of your tools to provide care. It's also a structured interview style, so we could objectively match our candidates. It's really hard, like we were mentioning before, not everybody has the same opportunities for clinical experiences or the same locations, same areas of preceptorship or capstone. So by asking structured interview questions that are focusing on the behavior, we're able to objectively score and compare candidates. So the questions that you'll be hearing tend to be phrased as, tell me about a time when, or give me an example from your previous experience. So that's something that you can expect to hear. So kind of looking into how you would prepare for these behavioral interviews, we want to start with a brainstorming session. So just right now, thinking about before we move on to the next slide, you could think of any qualities of a clinical nurse. So maybe in your preceptorship or your instructors that you've had, think of some qualities that you really saw that were like, oh, that's a really good nurse. I really like the way they did that. I really like the way they communicate, or they really like the way they provide care in a certain way. So you could always start with, or any traits that you think are important as a nurse. So we're going to start with that. So here's a little chart of qualities of a clinical nurse. So when you're providing care in a clinical setting, you know, time management is the essence, delegation, we provide education, we communicate a lot as clinical nurses. So you could think of all these traits, or you can go the other route and say, okay, well, what is the trait of compassion and caring and advocacy and being culturally competent and having the ideals of how to be diverse and providing your care, right, for different cultures. You could start thinking of all those traits of a clinical nurse and start grouping them together and think, okay, well, these are all similar traits. And when you get all these traits and you put them together, you could start thinking about experiences that you've had, either in your work setting, clinical setting, in school, as a volunteer, and really think about times in which you've demonstrated those qualities in a memorable way, or at a high level, like you left and these are the ideas or the scenarios that really stand out to you, and focus on those and think of the story and kind of, you know, brainstorm over them and remember what happened. And you're going to want to elaborate on these stories. So you're going to think, okay, well, what happened? What part did you play? How did you demonstrate those qualities? So if you're choosing the communication and time management and education, okay, well, how did I demonstrate effective communication? How did I really utilize my time and, you know, find my resources to really advocate for this patient and provide education? And what was the outcome? Hearing all of those things when we're focusing on elaborating stories, you'll see that it's you. We want to hear about what you did. If you're ever thinking about these scenarios while you're brainstorming and you start to hear, oh, my preceptor or my instructor, I want you to rethink, okay, wait, let's restructure. This is a really good story, but I want to hear more, or we would like to hear more about what you did, right? You as the applicant, as the candidate, what did you do? We're not scoring your stories, so we don't need to hear so many, you know, heroics. I don't need to hear all of these like things that are higher level than I would expect to hear from a student nurse, but I want to hear your response. So it could be a simple situation, but your response to it is what we're really looking for. So we can use an example of you received feedback. So tell me about a time you received feedback. Well, I received feedback once on my report. My preceptor told me that I needed to tighten it up and get better so we can get out on time. So what did you do? Did you just say, okay, well, I'm just going to give it faster. I'm going to give all the information, just talk faster? Or was it that you asked for recommendations? You clarified to your preceptor what part about it? Was there any parts that that aren't effective? Or are there any parts that I could improve on? Is the information that I'm providing too much, or is the information not relevant to what we're doing when we're handing off? So after you collected that information, you made a note card. You were able to like write down pertinent things that happened during the shift to include in report. You made sure to do a run through before the end of each shift. And after that, you noticed a significance in the efficiency and the effectiveness of your report, and you were able to get out on time more often. So that's what we're looking for. So it's not necessarily that you took feedback and you're like, okay, well, I took feedback, so I just talked faster. You took the feedback, and what did you do after to be more effective in getting report? Okay. So you want to think about those stories. We're going to start your brainstorming activity. You're going to think about all the qualities of a clinical nurse. Think about some experiences, have the traits clustered up. Think of some experiences that you can elaborate on, focus on what happened, what did you do, what part did you play in it, how did you demonstrate these qualities at a high level, and what was the outcome. So we really want to hear those stories, and you can write some down. And when you write them down, put them on a little piece of paper. You can leave them in your purse, your backpack, put them in a jar at home, and take some time to practice. And so every so often you can reach them out and just practice. When we want you to practice, why this is important is because we want you to review the stories so you feel comfortable sharing them. You feel a little more natural when you're sharing these stories. You're not being so scripted and stiff when you're talking about them and trying to remember and looking up at the sky to make sure that you hit all the points of the story. You can practice in front of a mirror. You could record yourself with a friend. You can practice speaking out loud. I know some people that write down all their responses, or you type them. Maybe you're a person who uses their iPad and you type all your notes, so you're used to typing and you're reading it. But when it comes time to actually speak to a group or the person that's interviewing, it's a little more difficult. So we want to make sure that you give yourself some time to actually use the spoken word, right? Practice how you would speak. Look at yourself in the mirror and see how your face is changing while you're telling your story, and then maybe like, oh, okay, maybe I need to slow down a little bit. Maybe I need to calm my face a little bit. I'm a little too excited, or I'm not showing enough energy. And the more you practice, the more comfortable you're going to feel when you sit for the interview, because people are going to really be able to hear you and show yourself and like really have showcase your abilities, and we can see your personality. Okay, so we went over the panel, how that structure is going to go. We went over what behavioral style interview questions are, some tips to think of some scenarios to share for you. So now we have some questions that we can go over, the types of behavioral questions that you would maybe hear. So we're going to go over, tell us about a time when you needed to escalate a situation or concern quickly and efficiently. What was the situation? What action did you take to escalate this care? And what was the outcome? So you see here that the question is about how you escalated a situation, but remember in your brainstorming activity, you really wanted to cluster those traits. So yeah, this question is about escalation, but you can definitely integrate the traits of communication, delegation, and how you utilize your resources. So that's really being able to showcase, just because you escalated a situation doesn't mean you walked in and all you did was escalate. You use your communication skills to communicate to your team of what needed to be done. You delegated some tasks. That way you can maybe put some more focus into that task, and then you utilize your resources because you don't do it alone, right? When you're escalating a situation, you use all the traits and all the skills and strengths that you have to be able to get a situation escalated. So with the prompt, you see there's a situation, what action you took, and what was the outcome. So we'll see that in the next question as well. Tell us about a time when you needed to delegate a task to a member of your team. What was the situation? So there's your story, what happened. How did you communicate your needs to your colleagues? So what did you do? And what was the outcome? So again, those prompts are there. So you can think about a story. What did you do and what was the outcome? And yes, again, this is about delegating a task, but we bring in the other traits of communication, delegation, using your resources, and working together with a team. Okay, tell us about a time when your patient's plan of care suddenly changed. So what was the situation? How did you respond to the change? And what was the outcome? So again, we can integrate those other traits to highlight what we did and how we, capitalized on what we had available. So prioritizing, delegating, using your resources, and escalating to respond to this plan of care. And I think I mentioned it a little earlier that it's not necessarily the story that we're judging, it's what you did, what your response and your role was in it. So when you're thinking of these scenarios and how you would answer these questions, always remember when you're practicing, you want to hear, we want to hear what you did. What did I do? What did I was able to prioritize and delegate and get the respond to this patient's change. And they don't need to be elaborate. The story can be as simple as the patient didn't have pain in the beginning of your shift and then began to have pain, or the patient's vital signs were stable and now they're unstable. So how did you respond to that? It could be a patient wasn't set to discharge until the next day, but they were able to declare the patient was stable for discharge all of a sudden that day. So that's a change in the plan of care. Sometimes that happens, but by talking to your patient and building the relationship with them that they may live far away. So it could be an elderly couple who relies on family and friends for transportation. They live in a small area, so maybe the pharmacy is closed. So when a patient is all of a sudden going to be discharged, there's an example of I was able to talk to the wife and let her know that this was the different change. So she was able to go ahead and reach out to her family members to help her get a ride, knowing that the pharmacy might be a situation that this patient's on new cardiac meds. I was able to delegate some tasks to my nursing assistant so I could have some free time to make sure that I reached out to my case manager and my social worker to find out if we can get the medications delivered rather than have them drive a couple hours out and not make it to the pharmacy in time, and then the patient would be out without their medications. So with all this work, if that wasn't able to get done, we want to escalate and reach out to the team and let them know what's going on. And in doing all that, you were able to provide a safe discharge for your patient when it was all of a sudden a new plan of care. So those are the types of things we want to hear. So yeah, it's as easy as a discharge being moved up, but knowing what you did in response to that is what you want to emphasize and focus on. So we have some more behavioral interview questions. So describe a time when a patient, family member, or colleague's view was different than yours. What was the situation? How did you respond to the situation? And what was the outcome? I hope you're seeing this pattern here, like the sequence of story, what you did, and what was the outcome. You could use an example in this for this question of in a mother-baby rotation, there was a new family and they chose to opt out of vaccinating their newborn. And so you realized it was a cultural difference of the view that you had. So you wanted to make sure that you were being respectful and still held on to the relationship you had built with them. So you provided education and, let them know the risk versus benefits of them choosing not to go forward with the newborn vaccinations. You gave them some time to decide. When you came back, they chose still to continue without the vaccine. You appreciated their response and just continue to provide that care and that trusting relationship that you had already built. And that could be an example as for this one here, when you had to deal with somebody whose views was different than yours. We also have tell us a time you received constructive feedback from a member of your team. What was the feedback? How did you respond to the feedback? And how has this feedback shaped your current nursing practice? So we talked about this a little bit before, about getting constructive feedback about maybe the way that you gave report. And so you can use that as an example. But you could also use this as an example of, I'm going to skip to the next question and then we'll circle back to this. Tell us about a time when you advocated for a patient, family member, or a colleague. What was the situation? How did you respond to the situation? And what was the outcome? So again, we're working on a question about advocating for a patient, but we're going to still mention our teamwork, our relationship building, providing compassionate care, and utilizing our resources. So I think you've got the sense of the cadence of, we're asking us for a story, how you responded, and what was the outcome. I think a tip that I would like to give at this point is to really listen to the question, listen to what we're really asking. So if we go back to this question about constructive feedback, and I know we talked about this in a couple slides back, was we're going to ask about feedback. So it's not that I'm asking about feedback to make sure that you've never had a mistake, or, you know, oh, I'm so good at my nursing and my nursing rotations, I've never received any feedback. Everybody receives feedback, whether it's constructive or whether it's some praise. But what you want to hear is, what did you do when you received that feedback? Did you just kind of respond and not respond? Or what did you do and what steps did you take? So really hear what the question is asking and structure your answer to answer those, you know, like more in depth of what is involved in actually receiving feedback. Okay, so those are some examples of questions. Now we're going to move into the interview. So when you're sitting there and you have a panel, you're with 3 other people, you're hearing their answers, really listen. I think we just mentioned this. Listen to the question fully. If you need clarification, ask, but don't answer the question until you fully understand what's being asked. You know, there's people who make mistakes where they don't really understand and then they answer it in a whole different direction. So you want to make sure that you clarify and make sure that you're going to take that answer and your response into the right path. That way you're really speaking to what is being asked of you. So questions have multiple components, right? So listen and remember to answer all of the components of the question. So if that's something that's hard for you and you have a piece of paper, you could write it down next to you just to kind of tick off when you hit the responses. So you want to make sure that you answer all of the components. Like we heard, there's a story. What part did you do? What role did you play? And what was the outcome? So you want to make sure you answer the components of the question. So if it's something that you need to have on the side, go ahead and write it down, just to make sure that you're being effective in answering all the components. You want to use examples from your experience. So you could use clinical rotations, your internships, externships, your work experience, volunteer. You just really want to showcase yourself when answering the questions. And I know that's something that's a little difficult for most of us to do. I think we're all a little bit, you know, we're not like too much of showboats. We're there to provide care for people. But this is the time where you really want to think of those situations or experiences when you're really proud of yourself and you're really performed all of those traits as a nurse really strong. So you can share that with us and showcase it and really talk about yourself in a positive way, as if you were talking and giving praise to someone else, because this is just something that we want to hear about how you respond to situations. You want to bring your best self. So you want to limit distractions. I know there's a lot of people who are used to being on Zoom at home in the classroom setting. And sometimes, you know, we have appearances from cats and dogs and what other animals are in there, but we want to make sure that if you're going to be in this panel interview, you limit those distractions. So maybe go in an area where your pets don't make an appearance. If you know that your dog responds to the mailman in a loud way and starts barking, you want to maybe be in an area, and that's the time that your interview is, maybe go to an area of your house where you won't be able to hear that, because that's a little distracting when you're in the middle of an interview and your dog's barking. You want to position yourself so the audience can see and hear you clearly. So practice. If it's, you know, the day before your interview and you want to go into the room that you're going to set yourself up and put your computer or laptop, make sure the lighting's okay, the time's been changing, turn the lights on, make sure you can see your face, that it's not covered in a shadow, because it's really important to be able to connect with your audience. By connecting, we want to, it's hard to say that in a virtual setting, but you hope that you would be able to see the people on the screen and be able to, you know, use all those nonverbal cues to really show yourself, make sure you're engaged, but also show yourself as well. So just being able to smile and show you're connected with the audience there. Don't be swayed by another candidate's response and be your authentic self. I think we covered this a little earlier. We were talking about really listen to the question. If you need clarification, you can ask. Sometimes we've had people not really hear the question, or they heard the first person's and the first person answered in a little bit of an off way, and so everybody else continued to answer it that way because they thought, well, maybe I heard it wrong. So definitely okay to ask clarification, make sure you understand what's being asked, and don't be swayed by other people's answers. Really just kind of stick to what you feel is being asked and stay there. You want to showcase situations that highlight your unique abilities and personalities. I hope that where it's coming through, we really want to see you, the candidate. Like I said, we're not focusing on these really complex clinical situations. We want to hear you, how you respond, and how you utilize all those tools and skills and traits of a nurse to your strength, and really turn those around and make memorable moments and experiences while you're providing care. We also would like you to breathe. Sometimes just a deep breath really just helps kind of refocus, recenter yourself. It's okay to be nervous, definitely. We don't expect anybody to be on a panel interview and not be nervous, but we definitely want you to still bring yourself forward and let yourself be able to talk and speak clearly. And sometimes if the nerves get the best of us, it's hard to do that. So a deep breath is always good to kind of just breathe in, let it out, recenter yourself, and then continue. Okay, so we have some tips and tricks for success in the panel interview process. So be true to yourself. Allow your human to human connection shine. Yes, it's different before. I mean, it's been 2 years, so I'm not really sure how many of us are used to interviews in a person-to-person setting. You know, Zoom has pretty much taken over the way we have meetings and go to school and maybe have interviews and check-ins and things like that. But you can still connect and be true and let yourself shine through Zoom. You can use your nonverbal cues. You can nod your head, you can smile. There's times where it's appropriate to laugh, where it's as a group, they collectively will, you know, enjoy what somebody said. Don't allow other people's answers to minimize yours. So what that means is your clinical rotations were a little different, or the settings were in a smaller community as to where somebody on the panel had bigger hospitals and, you know, more complex environments that they were in. And so you feel like, oh, I don't have those big stories. Well, it's fine. Be proud of your story. That's what's going to make you different from everybody else. Remember, it's not what you say. It's is equally important as how you say it. So even though you may see your story as not as complex or not as something that's like more, you know, it's a little more simple, it's how you're going to say it. How are you going to present that? And how did you communicate the story and really take pride and ownership of what you did? That's what's going to set you apart. So don't let anybody's answers make yours feel like they're less. It's your story. You chose it. You thought about it. You're really proud of it. So continue that process and really let that shine through. And if nothing else, just remember, this is, you could think of it as not an interview. It's just a simple conversation of us trying to get to know you, and try not to make it bigger than that, because that's when things get a little rocky and people are, you know, kind of get off balance of what they're there to do. You've worked hard to get to this point. So really just use this as a showcase, conversate, tell us about yourself, and stay engaged. Okay, so we're going to go over the nurse residency program. But before that, I'll ping over to Carly, who's our HR rep, and I know we have some questions in the chat. Is there anything that we would bring up, or we can hold off till the end?
Hey, Letty, I think most of the questions that have been getting asked are just in regards to things that you've kind of already answered, just about the interview questions themselves. Where can they pull their experience from? Can they use some of the examples they used in their supplemental questions on their application? Those type of things, but nothing too HR related.
Okay, all righty. Thank you. Okay, so we're going to go over our program structure. You haven't already heard this, and then we'll go into our Q&A session. So our nurse residency program is an ANCC nationally accredited transition to practice program, which is a program that we take new graduate nurses and we provide them an orientation to successfully transition from an advanced to beginner to a competent nurse. So it's a one-year program. We have clinical orientation. We have a curriculum that's based on Vizzian's 3 domains, and it's guided by our nursing theorist, Watson, Caring Science. But the overall goal of our program is to develop these new advanced beginner nurses and to competent, compassionate, and committed nurses who make a positive impact in the lives of our patients. So this is our curriculum. We follow Vizzian's nurse residency program curriculum, and how this was developed was sometime when I was becoming a nurse. We were noticing that there was a lot of nurses coming into the field or into the profession, and they weren't staying the first year of their residency. So the medical centers got together with the nursing schools all across the country, and they put their minds together and thought of why this is happening and how we can provide a program that will prevent that. So they built this program on evidence-based information, and it's based on the 3 domains of leadership, patient outcomes, and professional role. So it provides you support throughout your transition from a new nurse to throughout 1 year of your first year of nursing. So we do that here at Stanford by providing supportive and collaborative check-in meetings. So throughout your orientation, you'll meet with one of us nurse residency coordinators, or you'll meet with a nursing professional development specialist who will follow you in your orientation. They'll check in with you regularly in your orientation with your preceptor and your leadership team. You'll have clinical orientation with a dedicated preceptor. So it's a sketched out amount of time that you have that's to develop yourself with that support and help of a preceptor. We bring you in out of the account regularly for seminars and simulation. So we focus on those 3 domains, and we provide content kind of flexible and based on what the nurse residents are needing at that time, but we stick into those domains of leadership, outcomes, and the professional role. And how we cap off the end of the nurse residency program is with an evidence-based project that you'll work with your cohort counterparts. So this is a little graph of our residency program participation and retention since 2016. We have been growing in volume quite a bit. In 2016, you'll see that we had only a total, well, we had a lot, still 61 nurse residents join participate in our program with a 62% retention rate in that first year. Flash forward to 2021, we brought in 169 nurse residents, and we were able to maintain a retention rate of 95%. That's something that we're really proud of here. Also, if you look at FY22, we have 106 that have already started and are in the middle of their orientation now, and we're set to bring in about 200 for the remainder of the year, FY22, the fiscal year of 2022. These are the departments that are hiring into this cohort for the nurse residency program. Something unique to Stanford that you'll see is the AAU, Adaptable Acuity Unit. You may see in other hospitals, you'll see, there's med surg or there's intermediate care. All hospital units are very specialized. So we have surgical units that take care of all surgical patients. We have medicine units that take care of all medicine patients. But what the AAU stands for is that we are able to provide care from someone in acute care level of care, meaning they can have a ratio of 4 to 5 patients to 1 nurse, all the way until like an intermediate level where it could even be flexible to a 2 to 1 or 3 to 1 patient to nurse ratio, so that the level of care doesn't affect who's caring for the patient. They stay in the unit where the nurses know that diagnosis or procedure that they've had, and they just continue there. So that's something that you'll see unique to Stanford. So we have the medicine and surgical units, we have critical care, oncology. A new area is the adult emergency department that we're hiring into this cohort. We have the inpatient float pool, inpatient psychiatry, and clinical trials, which is a part of our nursing research department. Here is our summer cohort timeline. Here we are in the middle. We're at June 7th. This is our interview preparation webinar. So our application was posted in April. We were screening applications up until Memorial Day. We've been planning, and HR is currently still reaching out to schedule these interviews that will start on June 20th. And the panel interviews will be from the 20th to 24th. And then our unit level will be from the 27th up until the 1st. Final offers will be out to HR by July 8th. And in between that July 8th and the time of the cohort start date is 22nd. We'll be working on everything and meeting all the requirements to get the people started. Okay, so we have got to our Q&A session. I'm going to just check the chat here, and I have our current nurse residents. We have Ryan, and we also have Anna Sullivan, who are joining us to provide information on the nurse residency program. I'd like to welcome them, Ryan and Anna.
Hello.
Hello.
Hi.
So Ryan is a nurse on E2 cohort 35, and Anna is a clinical nurse on K4, and she's from cohort 32. So I'd like to open it up to everybody. I will stop sharing my screen, and then we can bring you in, and everybody can ask questions to our nurse residents. They're here to answer your questions.
There's got to be like one question.
Right. Ryan, what's a
Sometimes
question
it's
you would
hard.
have got? Oh, go ahead.
No, I was just going to say, sometimes it's hard to just like open it up and ask a question. So if it would be helpful, maybe Ryan and I can talk a little bit about how we started
For
in
sure.
the program.
That sounds like a
Ryan,
good
does that work?
idea.
Yeah.
So as she said before, when the mailman's going to come, make sure your dog is not barking. The mailman is coming and my dog is barking. So apologies if you get distracted by that. So my name is Anna Sullivan. I am on K4, which is the surgical trauma. Sorry guys, the surgical trauma transplant ICU. We mainly do kidney or liver transplants, some kidney, but mainly liver. J2 does lung and heart transplants. And I started in June of 2020, and in June of 2020, K4 was the COVID unit. So I got hired as a SICU nurse, surgical trauma ICU nurse, but immediately learned how to do that in COVID, and then worked sort of exclusively as a COVID ICU nurse for about a year, a little longer than that. And I went through the same process that she's talking about today, like the panel interviews on Zoom and figuring that whole thing out. And I'm still on K4. So this June will be 2 years for me. And I love it. So that's just a little bit about me.
Cool. Well, my name is Ryan Stark. I am on E2, which is the medical oncology ICU. So pretty much most of our patients come to us, have some sort of ICU need, depending on the patient, obviously, but most of them have some sort of underlying cancer, a history with cancer, or ongoing cancer treatment, something like that. They usually comes to our floor. Just like Anna said, I went through the same process as you guys did. I signed up for the webinar. I took like 1 million pages of notes, panicked for a little while, finally got my stuff together and figured out what I was going to do. But I will be a year on the 27th of this month that I started the program. So I graduate at the end of this month, and I'll have my first year on E2. But the process works, guys, I can tell you that. So what you guys talked about today, all the slides, all the things that, Anna and I can share with you guys, it really does help. And it really helps the process to get you into the door and get you onto unit.
I have a question for you too. My name's McKenna. Thank you for taking the time today. Do you think there's anything that you did in your panel interviews that made you stand out, like anything specific?
I would say no. The only thing that I think I did that I wouldn't say made me stand out, but made me maybe more confident was I really did prep. I will be really honest, I did not think I was going to get this job at all. And I didn't know if they were even going to continue the residency at that point, because all the other nurse residencies in the Bay Area had been shut down because of COVID. And so it was sort of unclear if this one was going to go. So I decided before, when I found out I got the interview, I decided I'm just going to use this as a learning. I'm going to prep, I'm going to put my best foot forward, and if they like me, they like me. And if they don't, they don't. And that's totally fine. I'm just going to use this as like a learning experience. And I really prepped. I used my phone and I recorded my responses, which I'm very glad I did, because the first time I went through some of my responses to those prep questions, they were like 5 minutes long and they really need to be 2 minutes. And the other thing I did was a couple of slides ago, and I don't remember where it is, but a couple of slides ago, they showed like a picture with all these different traits around it and how you can like pull like communication and leadership and teamwork and that sort of thing. I thought of examples that fit a lot of those so that I wouldn't be scrambling at the time to try to find like, okay, what's my leadership example? What's my, like my escalation example? I tried to find like 4 stories that covered a ton of stuff so that in the moment I could sort of tweak it for whatever that specific ask was. And then I recorded myself answering that question, or like various questions. I mean, you can Google behavioral questions and a bunch will come up. So I just answered them over and over on video until I got comfortable with it. And I think that level of prep and sort of taking the pressure, the combination of taking the pressure off myself and really preparing, made me comfortable in the interview, which I think came across. That might have been too much information, but that's what worked for me. I don't know, Ryan, did you do the same thing?
Yeah. I was lucky enough to have one job interview prior to the residency program interviews. So I kind of had that as a precursor, if you will, but I spent a lot of time prepping. Like Anna said, the questions are, you can find those anywhere you want. So you can pick your poison on any of those questions, but I really focused on picking a few stories that I felt could translate into any of the types of categories they might ask you. I'm not sure if this is a practice everybody did when they were in nursing school and things, but I kept a journal of my rotations and my clinical experiences. So I was able to go back through and review those and kind of look and say, oh my God, I remembered this patient or this interaction. So I used those stories as kind of my stepping stone to start to create my answers for these questions. I spent a lot of time, I didn't record myself, but like I'd be in the shower, I'd be in the car, I'd be going over my responses in my picking out my stories in my mind. And when it came to the actual interview, I don't know if it was anything I did special to make me stand out, but I tried to be authentic as I could to me. I answered with my stories. I didn't try to church anything up. I didn't go for like some extravagant, like, I was in this code and I gave perfect CPR for 45 minutes and we got ROSC after this, that, and the other thing. And I just picked what I had in my arsenal and I just went with it. And I answered it as if I was talking to future colleagues and friends. And that allowed me to become a little bit more
Not me
comfortable
in
with
a
my
Zoom.
response. What's that? Oh, but it was Zoom. So I got used to being on Zoom too. But it was just one of those things where I think practice, guys, really does help in crafting those responses, because you think you might have a very short response, but it clocks in at like 5 minutes. I was like, oh, I had a few of those, and I was like, all right, let's wrangle that back in. So spend some time going over those responses. Get a partner, get a friend, spouse, SIGO, whatever you have access to, and just say, hey, for the next hour, let me have some time. I want to practice. And that was the most helpful for me, just kind of spending some time answering those questions.
Yeah, and just to add one thing to what you're saying, the other thing that I think is important in these interviews, especially because we're not in person, these are on Zoom, is the people that are interviewing you, like if the managers are listening or anything, they're looking at potential colleagues, right? So they really want to see you engaged. So it's not a thing where like, okay, somebody else is answering. So I'm going to check out and try to like rehearse in my head in the moment for like what my answer is going to be. Yes, you're going to do that to a certain extent, but you also really want to listen to the other people's responses and like engage, because they're judging like, are you engaged? Are you smiling? Are you shaking your head? Are you nodding? Are you like encouraging of this other person? Yes, they're like up for the same job you are, but oftentimes, like at my final interview, it was 4 of us and 2 of us were getting hired. And the other person that got hired was like my work wife for 2 years. Like she was the best. And so I, like, you know, engaged with her on that interview and then worked with her for 2 years. So like nursing is a team sport. So make sure that you are engaged in that interview process and encouraging the others on the panel with you, rather than like being in your head.
That's a
Hi,
good
Pam
point.
here. Oh, sorry.
Oh no, I was just say that's a good point. I felt the same way. Engagement
Oh.
there. It's hard to read that sometimes through Zoom, but like they can tell if you're zoning out or not paying attention or just kind of, you know, a space occupying or a person
Definitely.
occupying a square. So
It's very different than being in person. As far as your department level interviews, did you do anything differently as opposed to your panel interviews for prepping?
For me, no. I mean, realistically, my experience is my experience, and that didn't change whether I was going to be interviewing for an ICU or like for E2 or K4. My experience is my experience. So I didn't really, I like went over my answers again because there was a week or 10 days or something in between the two. So I sort of stayed fresh on it, but I didn't like prep something different because I was interviewing for trauma versus interviewing for oncology or something like that.
no, I was the same. I didn't do anything special. Just I went with the answers that I had. I changed my suit. I wore a different suit, but that was about the highlight of my changes there.
Are the people interviewing us on the panel going to be the same people that might interview us like for unit specific? I'm just wondering like if they ask similar questions. I don't want to accidentally like be nervous and use like the same story or, you know.
You can use the same story. If that's your experience, then use the same story for sure.
Yeah.
I mean,
and they tell you that too. Like if you have your stories, you can use them in both interviews. I did.
Okay.
Yeah,
Yeah.
for sure. And if you use them in your, I don't know if it's the same still, but when I did my written application, there was like 4 sort of like long paragraph answers that you were supposed to give. And 2 of my stories were those answers I gave in that. And then I used in my first interview and I used in my unit interview.
Cool. Thank you.
I have a question kind of about like the setup of it all too. From my understanding, it was like a panel interview with 4 others. And then for the unit interview, is it 1 out of the 4 are selected for the unit, or is it each one gets a unit interview?
Mary Beth, hi. It just depends on the management. I mean, there can be panels where, remember, if it's different management teams are sitting on there. So there could be panels where each person gets taken by one of the units, or it could be a panel where maybe the people on the panel just didn't fit with those managers, or maybe just someone found a fit. So like medicine and surgical panels go for 2 days, right? So sometimes they're like, okay, we're going to bring this many in, we're going to hire. So it's no set. They don't have to take anyone set from each panel, but everybody can get taken to the unit level. So it just matters if the managers and leadership see that you're a fit for the unit.
How different were the panel interviews versus the unit interviews? Are they both behavioral style questions, or what's the difference between the two?
Mine were both the same. I had, to kind of piggyback that question, the previous one, I had my first one was the general one to get the unit interview, and that was me with 4 other students or 4 other applicants with the group, and then my panel interview was similar as well. It was 4 candidates with the managerial team, and all my questions were the same, not the same questions, but the same behavioral style. Some units are different. I'm assuming the managers can kind of answer questions. I know some people from J2 had a situation-based question they asked them, but we didn't get any of that. It was really just behavioral questions for ours, or for both of mine.
Yeah, same for mine. I think the difference is basically the first interview, like the broader interview, has managers from all different types of units. So like like I was interviewing into the critical care region. So there's like, what is there, like 6 ICUs, I think? I think there's 6 ICUs. And so there was managers from each, is that right? Am I missing one? I think there's 6. There's managers from each on there with like HR. And after that one, manager, they all sort of talked. My understanding is that they all sort of talked and said, okay, well, I'm interested in Ryan. Okay, well, I'm interested in Anna. And then I had an opportunity to speak to the manager of the unit when they called to say, hey, you're going to go through to the final. Do you have any questions? And that was the opportunity to ask my questions because you can't on the panel interviews. And then the final interview was with that manager who was on the first one, plus 1 or 2 other members of the management team, so that he was basically saying, hey, I think Anna would be a good fit. I want the other managers to make sure that they feel the same way. And if there's no flags, let's go through this again and see, or like, I think these 4 would be a good fit. We have to pick our top 2. Who do we think we're going to pick? And so it's the same thing, but with a couple new people to make sure that the thinking is all aligned. So you can use the questions might vary a little bit, but you can use their same examples or, draw from their same experience.
I had a question for Anna or Ryan. I know this may sound personal. My name is Vanessa Barnum, but I live in Southern California and I applied and I did see that from the previous webinar, they talked about relocation. Were you guys natives from the Bay Area or did you know anybody in your cohort that moved or relocated? And if you were, or if you were not actually, was it easy for you to transition from one area to another? Or if you knew somebody at that time, was it easier for them or did they share their story with you?
I'm not native to the Bay Area. I moved here in October of 2019 before I got this job, and didn't know anybody and didn't have any like connections anywhere or friends in the program or anything like that. I just sort of like applied blind and it worked out. So I don't know, is your question like, do they help with relocation or like?
Oh no, I was wondering like, was it an easier transition for you? Because I know that they offer relocation, but I wanted to see like, how did you feel coming into an area where you didn't know anybody and just starting this whole new cohort?
This might be a better question for Ryan, only because I moved here in October of 2019 and I started in June of 2020 when I have no family here. I had no friends here. The world was shut down. I have now 3-year-old little boy. At the time, we canceled his first birthday party because the world shut down that week. So how easy was it? I would say like life has been so freaking weird for the past 3 years. I don't really know if there's a good answer for that question, but I will say that checking in with your cohort and becoming friends with your cohort was awesome for me because nobody understands what you're going through or what you're like what's happening or like the day-to-day more than the other people that are going through the same thing for the first time. This is going to sound really morbid, but when my work wife, the girl who I went through the interview process with, when she and I either lost a patient or had a really, really rough night, we would go down to the cafeteria and get bacon in the morning. And that was like our thing. Like when one of us had a rough night, it'd be like, I got to get bacon. And it's like, all right, I'm in. And if you need to get bacon, that means you had a rough night, I'm going to go get bacon. So it's like little things that like nobody really gets what like how you're starting and what you're going through more than the other people in your cohort. So I don't know if I'd say it was easy or it wasn't easy. I'd say that starting any residency program or starting any nursing career is going to be challenging for a variety of reasons. But as long as you're leaning on your people and building those relationships with your cohort and with your people on your unit, then it works out. I don't know if that answered your question. I hope it did. Okay.
I mean, I'll throw in my 2 cents on that one. I am technically not a Bay Area resident. I have been here since 2010, but I applied to the program with thousands of other people, obviously, just like you guys all are. I was lucky enough to actually be in a cohort with actually a fair number of students from my actual graduating class of nursing school. I think there was like actually 6 or 7 of us that made it through and got positions in the program. So I was able to kind of at least rely on them a little bit, but you make very fast, fast friends in your cohort. ours have all been on Zoom, but even so, like I see them in the hospital and you pass along by. Like I just met up with a couple of people that I hadn't seen since for a while in that. We sat down, had a little chat, and it was nice being able to kind of compare stories and talk about work with someone that's going through it. Because when you get there and you go through experience, you're literally being thrown into an environment with like stone cold veterans, right? I mean, you have people that have been there for years and years and years, and then you're this like, hi guys, first day on the floor kind of thing. So having somebody that you can talk to and be a part of that, it comes fast. You guys make quick friends. And you do go through a lot of stuff as your cohort. You guys meet regularly, you talk regularly. So you'll have a good time adjusting. As to coming from a new spot and relocating, I can't really speak to that, but I think you have some resources at your fingertips, and your classmates are all resources that you can rely on as well.
Thank you so much for answering the question. I have one more. Did any of you choose day shift or night shift, or is there a difference? And what is a day-to-day like as far as if you chose day shift or night shift, like what's the day-to-day and when do you meet with your cohort?
I didn't get I went into it and kind of figuring that it was going to be a night position, but the position I happened to be hired for was a night spot, which is what I wanted. I think it's unit dependent and it's going to be floor dependent. So I know the current cohort, there's a couple people that are going to be on day shift, and there are some people that are going to be on the night shift. And then some units do like a rotation. So you have some days for a few weeks, and then you rotate to nights, and then you rotate back to days. But I went into it thinking I was getting nights, and I actually wanted nights. And so I've been, aside from a couple weeks when I did my preceptorship, I've been strictly for nights, and it's worked out. Is that what you're asking? Or if it was hard?
Yes.
Okay.
Oh, no. I'm a night shift person. So yes, everybody comes alive at night. I also have a 5-month-old who is crying in the background. Sorry if you hear that. I was hired for nights also. And for me personally, I feel like that was a better place to start to learn your practice and learn your routine and your rhythm, because they round at night. A resident comes by with a fellow sometimes, some nights, sometimes just a resident, sometimes something happens and they're down in the ED and you don't see them for a while. They're always available over the phone, but like it's not like 15 people descending on your room to talk about their entire plan of care with like consulting services and all of these things. So you get to figure out what your routine is, and you get to become familiar with like the meds that I give every night. When I first started, they were all new meds, right? And so if you had a patient that had like 15 meds and every single one of them is new, that's going to take some time to work through. If I jumped over to E2, some of those meds that I give every night would be the same as the meds that Ryan gives. Some would be new because they're different patient populations, right? So now, 2 years in, I can get a patient with 20 meds and I'm like, okay, I know what this is, how to do this. I need to soak this in bicarb for 20 minutes before I can give it. Like, you find your routine. When you start on days, one of the challenges is that routine is disrupted by rounding doctors or by random like PTOT or nutrition or whoever is going to come through. So it's still an awesome place to start, don't get me wrong, but it's a little bit of a different challenge because your routine is going to be disrupted pretty consistently in the morning. At night, the different challenge is you really have to rely on your colleagues because there isn't always going to be 15 people coming around to see what's going on. So if something is going wrong, you need to be able to articulate what that is and or say, I don't know what's happening, but something is happening, and get the help that you need quickly in your other nurses and your fast and your charge nurses. So there are challenges to both. There are huge opportunities to find your own process in both, but they're definitely not, I would say, the same.
Yeah, I would agree with that. I precepted nights, and then I precepted days, and then I went back to nights initially. And I honestly felt like I learned more during my day rotation on just pure time management and how to squeeze in all the things that you had to do, because those days are hectic. Like, I mean, I think the first time, like Anna talked about rounds, it's literally like grand rounds. You have like 1 million people there and you like go head to toe and you do the whole thing. It took me like 30 minutes to do that. And I was like, oh my God, I am so far behind now. So you have a couple of those days, you learn real quick kind of how to bundle care, how to kind of tie things in together that all fit. So that was a good experience for me. And it really did help me when I transitioned back to my night practice to where I'm at now, because it is a totally different pace. It's a totally different style of care that you deliver during the day versus night. So you will learn a lot on both if you have the ability to precept on both those sides, but it can be a very different practice for sure.
Thank you so much.
I have a question back to like location. So I live in Sacramento, so I'll have to relocate. And I was wondering, how normal is it for someone to move to like SF and commute, or do most people live like locally in Palo Alto? Yeah, that was my question.
Great question. I don't really know. I live in San Francisco.
Oh, you do? Okay, so
I live in San Francisco.
possible
Yeah.
then. Okay.
Oh yeah. It's like a 45-minute drive.
Okay, not bad.
So it's not bad. It's not bad at all.
All right. Thank you.
I have a question. It might be a little specific, but I have experience working in the ED, and that would be my top choice for the unit here. But I know that it's very, if there's only hiring 2 people. So what would be your recommendation when telling stories from my clinical experience versus work experience? Because I want to tailor myself to that unit, but I don't want to pigeonhole myself and have the other units dismiss me if I'm only thinking of that one, if that makes sense.
I mean, I think you should use the story that best fits the question that you're trying to answer. Or if personally, if you have a really great story that you had when you were working in the ED and it fits the category of the question they're asking, use that. Or, if you have a better one from your clinical style, I would say go with that. I mean, it's a tricky one because, you want to get what you want to get out of it, right? You want to get to the department that you want to do. But I would say answer it personally with the most relevant story. I wouldn't try to pick one tailored specifically every question you have to ED if that's where you want to go. I would do the thing that fits the question the most.
Yeah, I totally agree. I think that you might not realize some of the like things that they're looking for, the managers are looking for. And I don't mean like you don't realize because you're new. I mean, like none of us might realize, right? Like who knows what they're thinking or what they're looking for. So take the example that it best suits the question rather than trying to direct yourself, because you might do more, like you might end up pigeonholing yourself when you don't mean to. So just be as specific to the question regardless of the location or the experience, if that makes sense. Basically what Ryan said. Go with what Ryan said.
Okay, thank you.
I have a question. Are we allowed to do 2 interviews? Because if you are, I am interested in research as well as in ER. So they are going to interview us both and choose whatever they ask, or has to be one interview for one unit?
I can answer that one. So the first interview that you will have is a panel interview in the department. We try to place you in the preference. You listed the first, second, or third choice. But that's the panel that you're placed in. So there's no opportunity to be on another panel. So you in order of preference, we put you where we can, and then that's the opportunity that you have. Past that point, it's the managers that are sitting on that panel interview that will bring you to a unit level department interview. So when you have that interview, that's the opportunity that you have to interview for.
I have a question. So this is my second time applying. Is there anything I can do to, if I don't get it this time, is there anything I could do to like improve my resume or just like my application in general to like better stand out to get an interview in the future, or anything? Just any advice?
I don't have any advice as far as improving, but I will tell you that the final unit interview I had there were 4 of us and they selected 2. One of the girls that wasn't selected reapplied to the next cohort, and she now works on our unit, and she's an awesome nurse. So I would say just don't give up, and don't, keep, nursing is a really long career with a ton of flexibility. So just keep trying to find opportunities for yourself that satisfy yourself and keep you interested and keep you growing. And that'll come through in your interview.
That well said. I don't have anything else for that. Just keep going and be yourself.
I'd like to ask a question. Oh, go ahead, Angela.
Oh, okay. So hopefully you guys can hear me. Sorry for the noise in the background. But is there just any overall general tips you feel as if like you learned during the residency program altogether that you think would be beneficial to all of us for us to know?
That's funny. I one thing I learned that was helpful for me at least, is I learned very quickly that I am not good at not being good at something immediately upon doing that said thing. And that took me a really hard time to understand, because I'm still learning how to do things and I feel that it gets better and better. But I think just have confidence in the practice that you have, in the experiences that you've used in your clinicals and your rotations to kind of launch you into your career, because it's very different. Like what I went through in clinicals and rotations and things like that versus what I do now are drastically different in terms of care and what you're doing day to day. So having that basic bones of what you know, really use that as your foundation and accelerate on that, and just learn as much as you can when you're on the unit. You'll get partnered with really great preceptors and really great people trainers and people to help you along the way, and just pick their brain as best you can, because they're there for your success. And they want you to be successful because you're going to be and I shouldn't say going to be, you are their coworkers and now colleague. So they will help you with everything, and just utilize everything as a learning opportunity that you come across, because there is so much stuff that you pick up every day. I mean, even me a year into it, I'm still learning something almost every day that I'm like, oh, write that down in my notebook, take a note of it. So I'd say think about those things. And also I tried not to look up anything or do any pre-work prior to starting. That was helpful, because I was really nervous about not knowing anything. And I started reading and I got like way into the weeds like real quick. And I was like, I'm just gonna take a pause and I'm just gonna let them teach me what they want me to know. And it was hugely beneficial.
Yeah, I would piggyback on that. I agree. Don't study before you start. You never know what your unit specific is going to need, or what you think you don't, just learn on the job and be okay with that. I would say a few things. One, to Ryan's point, and I mean this in the best way possible, basically nothing right now. You think you know what you came out of school knowing, and you do, enough to pass the NCLEX, and enough on paper. But when you're standing in somebody's room and they're decompensating and you're panicking and you have that feeling in your chest of I'm the nurse now, this is me now, what do I do? Those moments, you learn so much in those moments if you let yourself learn. So be open to not knowing anything, to asking for help, to knowing who your resources are. That's a big one. To Ryan's point, there are some OG nurses who are sort of move, I got this, and then there are nurses who are hardcore teachers. They want you to understand why the waveform looks like this, and why we need this IV here, and why this medication has to be taken with this medication. And so find the people and they're all types, and every unit, every floor, every job, there's going to be all types of people, right? So find those people that you connect with and that you feel comfortable asking for help from. And ask. There is no dumb question. This isn't one of those fake it till you make it careers. If you don't know, you don't know. And that's okay, because you'll know after you ask, right? So I would say find your people to be able to ask questions. Make sure that you see everything through the lens of this is a learning experience, and tomorrow you'll be better than you are today. And that's true for being a brand new nurse, and that's true for being a nurse after 30 years. And this takes a little bit of time, but find a routine. Find your routine and settle into your routine, because when things get crazy around you, if you have found your routine, you can fall back on that. You can fall back on this is how I do this. This is my routine. For me, that meant that I wanted to be on the unit. You can clock in at 6:40 p.m. I wanted to be on the unit by 6:35. I wanted to be settled. I don't want to be rushed. I don't want to be running to get to huddle. I don't want to have not been able to look at my patients. Like that doesn't set me up for success. So for me, that meant I wanted to be there with a cup of coffee, like ready to go before you had to start, you know? So I would say look for the helpers and find your resources. Keep your mind opening to learn everything and find your routine. Also, give yourself a lot of grace. This shit is hard. And you're not going to know what you're doing after a month or 2 months or 3 months. And that's okay. That's why this program's a year long. That's all.
Thank you, both of you guys. I appreciate it a lot.
I am curious about the monthly seminars and the evidence-based research that's on the website. For the monthly seminars, how have you found that in terms of adding it to your regular shifts? And what if it's scheduled during a time in which you have a shift? How is it structured? Do you find it enjoyable? And then for the evidence-based project, if you could share a little bit about what you're working on and how that works as well. Thank you.
Well, go ahead.
So
Go
for
ahead.
what's that?
I said, go ahead.
I was just going to say for the scheduling aspect, you put in what you want your schedule to be, but one of the managers manages the schedule. So all you really have to do is put in when these seminars are, and then they have to schedule around that for you. So it's not going to be like a seminar scheduled when you have a shift and you have to scramble to figure out what you're supposed to choose. That doesn't happen. People in general are really helpful and excited that you're in this program and want you to succeed. And so they're not going to be like, oh, well, what are you going to pick, your job or your education? Like that's not how this rolls. So they will help you schedule it and rearrange things and whatever if you need to. So you don't have to worry about that. I thought the seminars were really helpful. I really liked them and enjoyed them. And they gave me insight into stuff that I, talked about patients that I might not have had at that point or situations that I might not have seen yet. So I liked them. And my evidence-based project I did was on proning patients in the ICU with certain PF ratios and the life of COVID stuff. That was what we focused on. Ryan, you're probably doing your evidence-based right now, right?
Oh yeah. Oh yeah. We just got our feedback back. I made some changes. I guess to the question on the seminars, personally, I was lucky enough to our person that scheduled all of our seminars for us on the days that they were. So we didn't actually have to put anything in. I am gathering that is different on every unit. So you basically, the way that I was explained is like, if let's say you have seminar, it's always like on a Wednesday or something, a Tuesday or Wednesday, something like that. You try not to schedule yourself the day before because if you're night shift, then you literally are off for like no time, then you start your seminar. So you put in the times that your seminars are, and then they'll schedule around that, but give yourself a day before that you want to have that as an off day. I too found them to be super helpful. It was at first, the first couple, I was just like, whoa, I feel lost. Just because it was a lot. I mean, you sit there and it's a lot thrown at you, but you can go back to all the content that you get. You have a lot of supplemental stuff that you do in healthcare or HealthStream. You get a lot of modules that you can go through and they back up all the stuff you learned in seminar. And you can relive or go back to those for a whole year, I think, after your program and stuff. So those were really helpful. It is very pertinent to what you are covering. Like I noticed, I was like, is this just a coincidence or did we just talk about ARDS and the last 3 patients I had were ARDS? I was like, this is weird, but it does really translate into your practice quite well. And then, so you have the opportunity to kind of learn, and it's a very open environment. It's kind of like, I mean, I related it to kind of being in nursing school because I was in it through the first year of COVID anyway. So it was very helpful for me to go through all that prior to starting my shifts or going through my shifts. I found it to be very translatable. And then my evidence-based practice, we are kind of looking at in like the ICU population of hemodynamically unstable patients does using continual lateral rotation, which is like the automatic bed turns, if that decreases HAPIs more than conventional standard care practice with a wedge or a pillow. And then you work on it as a group. I'm sure Anna's was the same way. Like you're partnered up with, I think there's 7 people in my group. You kind of divvy up all of your work, all of your assignments and research and stuff like that. And then it kind of all comes together, but that's literally like your last month in the program. So like, you like all of a sudden you're like, oh, we're doing our evidence-based practice now. And you're like, oh my God, I'm graduating. So it comes after a while. So, but they give you the whole outline and the rundown and everything. It's been a painless process for us.
Yeah, that's how it was for us too. They also partner you with people in a similar region. So like you're not going to be doing an evidence-based project based on something that's happening in the ICU if you're not in the ICU. So they like couple you together, and then they give you a general topic, and then as a group you come up with like, we could ask this question or this question, and then they kind of guide you. So for the same with me, it was painless. It was dare I say fun.
Thank you so much for that information. A quick follow-up question for the seminars. Is there any times where you had presenters or teachers of other backgrounds? I just have a strong background in social work, and I was pleasantly surprised when I started my clinicals because it really, related to nursing and how I care for my patients. So is there a portion that's interdisciplinary, or is it strictly nursing educators? Thank you.
I think it's interdisciplinary. If I'm remembering correctly, there are a bunch of, I think part of the point of the whole program, right, is to sort of accelerate the exposure to all the different resources and all the different things that you're going to see, so that what might take you 3 years to get used to and see in your practice, you're seeing much faster because you're meeting those interdisciplinary partners, or you're learning about these different units or different patient population that you might not see. So I feel like I had like a nutrition, like somebody from dietitian, somebody from social work, like pastoral care, somebody talked about like neuro stuff and trauma stuff, like all different stuff that you might see. So it is interdisciplinary. Obviously, the main focus is going to be on nursing care, but nursing care is so across, like healthcare is so across the spectrum of things that I think they really work to make it as broad as they can.
Yeah, that's the way it was for our group. I mean, you do have access to a lot of different people. It is framed in the scope of like nursing's role and things like that, but it is helpful to see kind of when you have, for instance, like we just had our like palliative care and like hospice care lecture not too long ago, and it was from a hospice nurse, and it was her experiences and what it's like to do that in practice and things like that. So you do get exposed to lots of different environments, or I shouldn't say environments, but a lot of different people in places that you might interact with under the guise of your nursing practice.
Yeah, and just to piggyback off that, Ryan, I don't know if you're having this issue right now, but at Stanford right now, the AAUs are full, like very full. And so you might see patients that we had two hospice patients on K4 for like 2 weeks because they were meant to go to the AAUs and then get discharged out, and there's no place for them to go because the beds aren't open. So, or like someone who is really a floor patient and needs like intense dietary restrictions and consults and all this sort of stuff. So I was working with the dietary team a ton. So even if you're just in one sort of subset category, one unit or one floor, you're going to end up seeing all these interdisciplinary people that you're speaking to on the, throughout your program.
Thank you. I just want to let everybody know we have about 3 minutes left till 2:30. I know we started a little late, but I can invite one more question that Ryan and Anna can maybe answer. We could wrap up the webinar if anybody has one more burning question they'd like to ask.
Yes, I have a question. Oh, sorry.
You can go ahead. That's okay.
Okay. I know both of you did the panel interview for ICU, for critical care. Was there a specific unit that you wanted to go into, and did you end up getting that? And also, how many people were hired onto the unit that you started with in your cohort?
I'm trying to think. So when I applied, I want to say that I don't think we got to necessarily pick which ICU. I think it was just critical care, and there was a subset of like, the 6 different departments that you could go into. And I had ICU as my first choice. And then I was chosen to be on E2, which has been a fantastic experience for me. I did my preceptorship in oncology, and so I saw a lot of that stuff. But it was not, I didn't say I wanted oncology, ICU, or oncology like cardio, neuro. I didn't rank those out. It was just I wanted ICU, and then I answered my questions accordingly, and the managers picked for best fit, I guess. And then in my interview, one of the other guys I interview with is also on my unit as well. So we carpool in to work. His name's Kevin. He's a fantastic dude. We've gone a lot of things with Letitia. We've seen her before. We go to a lot of things together. So it's nice. At least I had one that came through my unit.
Yeah, I did the same thing. I said ICU as my preference. And then there is like neuro ICU, there's oncology, trauma, now a medical, that there didn't exist a medical when I started. So I just said ICU, and then in between the two rounds, the manager called me and said, I found out that I was getting another interview on the trauma ICU, and the manager called me and said, is this something you're interested in? So I sort of had the opportunity to say like, no, that wouldn't be my jam. I don't really want this, never mind. But I was interested and was like, hell yeah, let's do it. So that ended up working out. But I probably would have been excited about any of the ICUs that I landed in, so.
Sasha, do you want to ask your question really quick? I know you were neck and neck. We can fit one more question in just to fit you in.
Thank you so much, Leticia. Yes, I just wanted to know if you asked any questions in your second interview that you felt were really great to ask, or did you wish that you asked something to the interviewers?
So I don't know about Ryan's experience, but in mine, the second interview that's a panel interview, you still didn't have the opportunity to ask questions. So when the manager called on the phone in between was the only time that I got to ask questions. And the question that I asked that stands out in my head, I don't remember asking any others, although I probably did, was what do other new grads find most difficult about this unit? Like, where do people struggle when starting in this unit? And that helped a lot for me. And I look back on his answer frequently to think like, okay, this is like normal that people struggle with this, or this is, like I should expect this to be hard, that sort of thing. So that helped me sort of gather my own thoughts and sort of level set expectations for what I was walking into.
Yeah, mine was pretty similar. I didn't really have an opportunity until after the second interview when I had gotten my offer to ask questions. And I too asked one of the similar questions to kind of what Anna was just what is the biggest hurdle for new grads to overcome just in general, not just specifically on this unit or whatnot, but that you've noticed as something to work on as new grads. And luckily he was a good manager. I had him for a little while. He actually took another position not too long after I started, but he gave a really good answer of just, it's just adapting to your clinical environment. It's figuring out what you want to do, how you want to practice kind of idea. But I didn't really get a chance to ask specifically like unit specific questions in the interview because it wasn't part of the time frame.
Yeah, to follow up on what Ryan said, the answer to my question that my instructor gave me was similar to anybody starting this program, which was the first 6 months are super exciting and you're kind of riding on adrenaline of like, I'm a new nurse, I'm in this program. And then that adrenaline kind of starts to fall and you start to get tired and you start to get stressed and you're like, oh my gosh, this is still hard. Why is this still hard? So like keep riding that wave and lean on your cohort and know that it does get easier. You just have to lean on each other. And that helped me.
Perfect. Thank you, Ryan and Anna, so much for coming in and answering everybody's questions. I'm glad we were able to answer a really good amount of questions and really, I feel like they would have helped me. They were really good questions. Carly, do we have anything in the chat? I see she was answering away at that. I think she was able to get to everybody.
No, we got everyone answered. The only one was we had a final one just asking if there was anywhere we could recommend for candidates that are going through this process to connect with others going through the process so they can kind of lean on each other and provide some support.
There was a Facebook group for mine for like the cohort I applied to that was helpful. Everyone kind of posted. There's tons of Facebook groups and stuff you can look at, like Bay Area new grads, just in general like that I found to be helpful.
Yeah, I haven't searched it yet. I think I don't want to look, but I do hear there are a lot of forums out there. Just whatever platform you share, I'm sure you can Google it and you'll find something on there. Okay, everybody. Well, we're going to conclude this webinar. I thank you all so much for attending. I hope it's beneficial. We'll be posting this recording on our site. You can visit our nurse residency program page. It's a hard line to give you, but you could just Google Stanford Healthcare Nurse Residency Program and the link will pull up there. And we have an email there as well. If you have any questions, you can click it there and someone from our team will be able to answer. All righty, well, I wish you all the best of luck. Congratulations thus far on all your hard work, and we hope to see you in the interview panel. Thank you.